DJ Phono.
Hey, it's Thunder Walker with the Thunder Walker Experience. I'm so excited. We are in Georgia with the Smoke Currency Tour, and I can't wait to introduce you to this wonderful woman and everything that she has been able to do for women. This is Miss Felecia Dawson. Dr. Felecia Dawson, by the way, and I'm excited to be able to talk to her about what she's currently doing in Georgia for women and also for holistic healing. So tell me a little bit about what brought you to Georgia because you're not originally from here.
No, I am not. And thanks you for having me. I came to school down south because my people are from Georgia and Alabama. So I came to South because I like the weather better. And I went to University of Alabama in Birmingham. Then I came over to Emory and trained and Morehouse School of Medicine and been in Georgia ever since.
Wow. Now, explain to us what your practice is.
Well, I had a brick and mortar office for obstetrics and gynecology for about 25 years or so. And the business of medicine has changed. It's changed. I've loved teaching people how to be healthy. I love educating my patients, but the business part of medicine was really keeping me up at night. And so around the same time that I was getting out of medicine, I got into cannabis, learning from it from the We documentary with Dr. Sanjay Gupta. And I learned that cannabis was medicine, and we're not taught that in medical school. So
Absolutely. Absolutely. So you made that decision and then you started leaving when you say getting out of medicine, because you never really got out, right?
I know I just stopped going to a physical office.
Physical office. Okay. Okay. And it's interesting. Dr. Gupta, and I hope I'm pronouncing it.
Sanjay Gupta.
Sanjay Gupta didn't probably even know that he was affecting your life the way he did, right?
No.
And so, did you have to hear it from another medical doctor, or had other people brought cannabis to your profession? What I mean by that, did you have patients that wanted to use cannabis and you weren't really for that, or?
Well, people would bring it up to me in my practice, but I just never thought that much about it.
Oh,
You know,
gotcha.
I was like, it's not a big deal. But he was the first mainstream physician I heard talking about it as medicine. And he, too, initially was like, no, no, no. But once he did going around the world and exploring other cultures and seeing that it really has worked as medicine for thousands of years, it just blew my mind. And I love history. So going back and learning that in America, the doctors used to prescribe cannabis as medicine in the late 1800s and the early 1900s, go down to the pharmacy and get it across the counter sometimes, that I just thought that was wonderful. And we as physicians and patients have forgotten our history. That's all.
I love that we've forgotten our history because I think that's where we should start. You should always start with history. History is always something that would be able to show us where we need to go. It always shines a light on us as humans, I think. Tell me a little bit about Georgia and the ideas of where you believe it should be as far as cannabis and the legalization of it.
Georgia is way behind times.
Okay.
And all we have here is low THC CBD oil. However, I do notice that the dispensaries are being very creative in the products that they're putting together with that definition in the law. I appreciate that. But when we were talking about cannabis, because I went down to the Capitol when Stacey Abrams was my representative. She was the minority whip. And she was saying that the only reason we got what we have in Georgia is because we had a crippled little girl in a wheelchair. Because I was like, why is that? Because Georgia used to be Georgia is very business minded. It's like, this is like a win-win situation all around.
Right.
Medicine for the people, economics for the people. But she said the things have changed in Georgia. It's more law enforcement and the church,
Right.
taking over the politics at the Capitol. So things are very slow to change here in Georgia. And being one of the original Confederacy states, I think that prison industrial complex is hard to let go of, and they want to keep locking people up for nothing.
I totally understand. Totally understand. Tell me a little bit about where you see the practice that you used to have as far as being a gynecologist. How will cannabis help women when they are going through all the different stages of womanhood, including the grand finale of menopause?
Well, cannabis has been used by women for thousands of years for everything from low libido to menopause, before pregnancy, during pregnancy, after pregnancy. And my focus right now is to show physicians and the public and legislators that the research that we have on cannabis in pregnancy is not very good. It's flawed.
Right,
And
right.
it makes cannabis appear much more dangerous than it is. And it's not dangerous. No one's ever died from cannabis.
Correct.
But the research that we have is very flawed. And so my goal is to help shed the light on why this research is not good and encourage the creation of better research so that women, no matter where they are, be it pregnant or not pregnant, can use cannabis and know that it's safe.
I love that. And thank you for being that voice, because sometimes it takes someone that has been in your position to be able to change the minds of people that are making legislation. What do you want to see happen? Because I'm a mom and my daughter's disabled. What do you want to see happen for the caregivers? I think that that is huge for me. In Oklahoma, per se, I actually have to act like a compound pharmacist. I have to kind of take my gummy and divide it up and try to figure out what her dosage should be. So, for caregivers, what would your suggestion be for people that may not be getting the prescription for themselves, but for their loved one?
Well, I would push for legislation that can allow and facilitate that more. Find out who in your community is knowledgeable about cannabis and get with them. There are a lot of support groups out here, especially online. I would go online and find support groups that can tell you, and there are people online who are much more knowledgeable than me and a lot of other people. But I think finding your community, I think is key.
I love that. I love that. Tell me what your plan is for the next 9 months. I mean, you decided that you are not practicing right now, but what is your plans for the next 9 months in advocating for your goals?
Well, I am a co-founder of a company called Plants for Life, along with Marilyn Pierce and Oski Chevanier, Jamaican herbalist. We are about to publish a book this summer called Why We Die, How to Live. And we believe it's the first book that combines holistic living and cannabis in the same volume. So it's going to be evidence-based research looking at how you can prevent or reverse the top 10 causes of death in America. That's coming out this summer. And I'm also working on my own book on cannabis and women's health, focusing on pregnancy and using cannabis in pregnancy. So that's what's coming up for me in the next few months.
I love that. And do you have a title for your book yet?
For my personal book, no,
Yes.
but the book that we have co-written that's about to come out this summer is Why We Die, How to Live.
I love that. Why we die and how to live. And you said it could reverse the top 10. What are the top 3 reasons why we
Heart disease, help me out, cancer, stroke. I think they changed around. COVID was like number 2, like a couple of years,
Yeah.
but it wasn't even in the top 10. But yeah, heart disease, cancer, and complications of hypertension.
I see. Absolutely. Absolutely. I can't wait till that book comes out. Just recently, I was able to sit down with the director of the Oklahoma Coroner's Office, and she was able to give some major insight on exactly that, why people pass and what is needed to actually help us live a healthier life and a longer life. So I think that that's going to be amazing. I can't wait to put my hands on that. Now, let me ask you this. What this is so important, I think, to my viewers. When they get ready to go into an office and they're talking to their doctors, so many are afraid to check the box that says
Yeah.
that they're a cannabis user. How can we get rid of some of that stigma?
I would look really hard to find a doctor or additional doctor because you may love your family practice doctor or whoever your main doctor is, but they're not going to always be open-minded to cannabis. And you want to look at what have they said previously. You might want to try and feel them out before you make that confession because electronic medical records follow you wherever you are, and you don't want cannabis use disorder to go into your record because because you're using it to medicate every day, it doesn't mean you have a problem. You're treating it. You're treating a condition.
I got you. Oh,
So
my goodness.
I would, and just take time to interview people and find there's so many doctors who are friendly to cannabis, and you can have online consultations with them. You don't always have to be in their office that can give you guidance, but you just got to kind of feel out your own private doctor and see how they feel, and keep looking. You may find a doctor that better shares your priorities, and you can feel more comfortable and reveal all of yourself to them, because that would be the best optimal situation where you can be completely honest with your physician. You shouldn't have to hide.
Absolutely, because that box comes up, and no, at least every time.
Yeah.
And so, okay, so tell me this: how can we find you? If we the book that's coming out and your new book that you're working on, how can we find you?
drfelicia.com, and you spell out the word doctor, DoctorFelecia.com, and also plantsforlife.com. And life is spelled with a Y, so it's plantsforlife.com or drfelicia.com.
Thank you. Thank you. Thank you for coming and talking to us on the Smoke Currency Tour. And that's what's so unique about this particular tour. We try to travel across the country to have conversations with people that are for cannabis. That way you don't have to reinvent the wheel. There's someone that's already out there that has the knowledge that can help you get where you're going. Thank you so
Thank you.
much. I love this. Thank you.